today because I completed my monthly radio call-in show from 2 to 3. And so I appreciate those of you who are tuning in and who are present today. Also, many people around the state of Louisiana received a phone call from me today. I do want to assure you that it was real, and it's part of our efforts to make sure that people are aware of the continuing need for them to comply with the stay-at-home order, with social distancing, and with proper hygiene in order to continue to slow the spread, flatten the curve of this virus, this disease. We know that it is contagious and it is deadly, and we know that the mitigation measures, the stay-at-home, all of these things, they work, but they only work to the degree that they are practiced by the people of our state. One of the big questions that many people have had is about what's going to happen with our K through 12 schools for the rest of the school year. I have with me today, in addition to Dr. Alex Bu, Beth Ciano, who is the acting education superintendent, and she will be speaking soon about that, and she'll take some questions from you as well. And we're going to get to that in a few minutes. But as we always do, I want to update you on the numbers. Today, we are reporting 433 new cases of COVID-19 across the state. That is a grand total now of 21,951 confirmed cases. Again, there are asymptomatic people out there and mildly symptomatic people out there, and people who, for whatever reason, haven't presented to be tested yet. So there's more cases of COVID-19 than that, but those are the confirmed cases through the tests that have been performed and the results that we've received. Unfortunately, we have 90 new deaths to report today. Sadly, this is the second highest number of deaths that we've reported in a 24-hour period, with yesterday being the highest. So, as you know, we hit that milestone of going over 1,000 deaths yesterday. Well, we went over 1,100 today. Obviously, it remains the case that these are not numbers, these are people. And so we grieve for them, and we want to make sure that we lift their families up in prayer. Now, so that was obviously not good news. There is some relatively good news in the numbers if you look at the total number of new cases added, and more importantly, if you look at the number of folks who are in the hospital because of COVID-19. There are currently 1,943 patients hospitalized. 425 of those patients are on ventilators. Both of those numbers are down. So the number of COVID-19 patients in the hospitals and the number of patients that are on the mechanical ventilators, both down from yesterday. At this point, we've completed almost 122,000 tests, and we remain number one in the country per capita for the tests that we've administered. That really helps us to see what's going on in the state of Louisiana to be better prepared. And that testing is not as robust as we would like, and we continue to increase our capacity, both at the public lab and with all the private labs operating in the state, and some private labs outside the state as well. You know, so today is a mixed bag. We have a really high number of deaths that we're reporting, and the number of hospitalizations and vent usage is actually better. And so overall, we believe we are moving in a much better direction in terms of our case growth. We have flattened the curve. And the reason we can say that is because the deaths are a lagging indicator. We know it takes just over 11 days on average when someone dies, measured from when the onset of symptomatology was. So when the symptoms appeared, it takes about 11 days on average if someone is going to die for them to die. The exposure to the virus actually came ahead of the 11 days. And so literally people will die today because of something that happened 2 to 3 weeks ago, which is why if there's going to be a spike in cases because we let our guard down, it's not something we're going to see in our numbers necessarily for some period of time. And that's why we have to be ever vigilant and take all of these measures very seriously and understand just how contagious and deadly this disease is. And it's going to be great when we start reporting fewer deaths. And of course, the number we're all looking for is the number 0. I hope that day gets here sooner than later. But if you consider where we've been over the last 3 weeks, where 3 weeks ago I was standing here with numbers coming out of Johns Hopkins University and calculations made by Dr. Wagner at ULL that showed we had the steepest growth rate of COVID-19 cases anywhere in the world, to where we are today, I can only tell the people of Louisiana that I appreciate the degree to which they have complied and taken this seriously, and I urge them to continue to do that. And I know that we haven't had universal compliance, and so for those people who for some reason haven't taken this seriously, I'm imploring you to do that starting today. On the testing front, several new testing sites that we spoke about yesterday have actually gone online today, and we're working really hard to get more tests moved into areas where it's needed the most. And if you've got questions about those testing sites, because we did cover them yesterday, Dr. Bu is here to answer those. I want you to know we have 1,396 Louisiana National Guardsmen who are working on COVID missions. They've helped to package 1.1 million pounds of food at food banks across the state. They have delivered more than 10.3 million items of PPE, literally to every parish in the state of Louisiana. And so I want to thank everyone who's been part of these efforts, and especially all of these soldiers and airmen. I want to thank people who've been donating too. Speaking of donations, today we can report that Drax Biomass announced that they're donating $30,000 to help families and businesses both in Northeast Louisiana and in Southwest Mississippi. They have operations in both of those areas. In fact, of the $30,000, $20,000 will be for relief efforts in Washita, Morehouse, and LaSalle parishes. And Washita is one of the parishes most impacted by the tornadoes on Sunday. So that aid comes at a particularly good time. So I thank Drax Biomass for their generous donation. I also want to thank Tito's Handmade Vodka. They've made a generous donation of 72 gallons of hand cleanser and also 1,500 KN95 masks and 1,000 gloves. And so we appreciate Tito's donations to the state. And that may not have been what some people were hoping Tito's would donate to the state, but it is what we need most of right now. Today, as I indicated I would last week, I've signed a proclamation closing K-12 schools for the duration of the school year with respect to students. So students will not be going to schools. There may be some things that will be happening at schools with employees and adults and so forth. But I want to be very clear about something. This is not the end of learning for this academic year. It's just the end of students physically going to the school campuses for the remainder of the spring semester. I fully expect that instruction and learning will continue. I fully expect that our schools are going to continue with the nutrition programs to feed the students. That remains critically important, and that's some of the work that we're engaging in as we speak. So remote learning is going to continue, both high-tech remote learning and low-tech remote learning. And I know there are a lot of concerns about how this impacts student achievement and learning, especially lower income families in rural communities without access to broadband. And I just want everybody to know we're working very hard to address those needs and make sure that every student in the state, regardless of the circumstances they find themselves in or the geographic location where they live, we want them to be able to continue to learn. We want them to learn as much as possible and to minimize whatever regression that you would typically see before school starts back up in August. I know how disappointing a lot of this news is. It's been very difficult for students. It's been difficult for parents and teachers and administrators. and especially for our seniors. I happen to go home every day to a high school senior, and I know how hard this has been for him and his classmates, and it has been really hard for seniors across the state of Louisiana. It's unfortunate that we had to do this, but it's really important that we promote public health. Knowing what the CDC guidelines are for a state like Louisiana that has so much COVID in it. Again, I think we're third in the country on a per capita basis for the number of cases that we have. This is just a critical step for us to protect public safety. So it's not something we wanted to do. It's not a decision that we made lightly. And this decision that I made today when I signed the proclamation was one that I was asked to do by the school superintendents, by the School Boards Association, by the Board of Elementary and Secondary Education, and by the Department of Education, who is led by Beth Ciano, and she'll be up here in just a moment. So we're going to do everything we can to continue to support teachers and parents and students. And graduates, please know that we're going to make sure that you be celebrated as well. I don't know exactly what that's going to look like or when that's going to happen. So at this time, I'm going to step away from the podium and ask Beth Ciano to come up and to deliver some prepared remarks. I am going to ask that while she's at the podium, that you would address to her whatever questions you have about the school closure, and then when she's done, she'll be able to leave and go back to work, and then Dr. Bu and I will stay here to address the remainder of your questions. So Beth, if you come up.
Thank you so much, Governor. Appreciate your support. We certainly respect the governor's decision today to keep us all safe. But you know, learning is going to continue. We are going to continue to support school districts and charter schools, any schools around the state as we move forward. It's really important that we do a couple of things. First of all, we do need to focus on our seniors and help them make the way into this new aspect of their lives. I, like the governor, have a senior at home and face that every day. But second of all, we need to then turn our attention to the other students in the state and make sure that every student, that we evaluate their learning level in these next 6 weeks. We need to make sure that we determine what they need with regards to extra academics time. We need to make sure we understand how to start up the new school year strong and have everything in place to be able to do that for our students. We'll continue to support the school districts as much as we can. We'll be talking more to the superintendents and other school leaders tomorrow with additional guidance. We've already released some with regards to continuous education, and we will continue to improve that and work with them on their needs with regards to distance learning. So with that, I'll take any questions.
Obviously, this will linger past the summer or the remainder of this semester. What impacts of closing the campuses for students will linger maybe into next semester, as far as what level students are on or what they were not able to achieve as far as grade level wise?
I think it's really important that we assess that in these next 6 weeks, that we have a system in place, support the school districts in doing that, because they need to know where their students are. We want to make sure we understand their learning levels and that we make the appropriate academic adjustments to whatever they need and supports to start strong in the next school year. Yes.
But on that point, are you or is Bessie recommending a certain way that the district should be testing students or determining if students are ready for the next grade? Are you providing guidance on whether they should try some summer school or add days to the next school year? What specific guidance are you giving districts about how they should move forward in judging students' preparedness for the next year?
Well, it is a local decision. They will use the, working very closely with the educators in all of the classrooms, they will evaluate different types of work, similar to guidance we talked about for the seniors. It'll be a preponderance of information that is available to them as they judge the readiness of their students to move forward.
So there's not something specific that that the State Department is suggesting to the individual districts as a benchmark?
We will give out some guidance in the future with some suggested uses in order to do that. And so we will support them in making some of those decisions.
And how are grades going to be handled? Is that up to the individual school districts? Talk about that. Is it going to be pass-fail?
Yes, it will be up to the individual school districts to answer the first question. They will use a variety of schoolwork in order to judge that. At this time, we will likely not recommend pass-fail, but we'll be issuing some guidance to the school systems tomorrow in a call that we will have with them more specifically about that.
What about the school districts that do not have online or distance learning, online learning, however you want to describe it? How concerned are you that those students are really falling behind, or do you have, or have you heard where teachers are still reaching out to these students, whether it's through phone, email? I mean, I've heard school buses involved, dropping off homework, stuff like that.
Well, we do know that there are different varieties of distance learning. There's some high-tech and some low-tech. We support the school systems in using a combination of those if that works well for their students. We are helping them evaluate their needs with regards to technology, and we'll be offering some information with regards to how to access some of that technology over the next 6 weeks.
How concerned are you that maybe those students in particular are falling even further behind than those that at least have online learning?
Well, because there can be a combination of high-tech and low-tech learning, I think that they are all getting, based on their individual circumstances, some information, but it'll be important for the educators to evaluate that learning level that student is at to make those decisions going forward.
But districts, superintendents, even in districts that offer distance learning, say they're concerned about the learning gap. Would the department be recommending either mandatory or statewide summer school or an early start to the next school year to try to address that, or is that going to just be up to 69 different districts?
I think, again, it is a local decision as to how they would go about helping their students. I think if there was a need for any of that they would come to us and let us know, and we would certainly support them in any of their decisions.
And that's for the start to the school year in the fall. Beth, do we know if that's going to be if that's going to be moved up a little bit to the summer, possibly to August, or maybe even July?
Yeah, we don't know that at this point. It would be premature to say that.
I guess I'm just a little unclear on what kind of specific guidance you're giving individual districts at this point. It seems that they're largely left to their own devices, and that seems like that will leave students with different levels of access across the state depending on where they live. So what is the state doing to make sure that school districts and students are actually getting what they need?
Well, we are working closely with the school districts to assess where they are in their plans. Everyone needs a plan in each community to help their students, and so we are working individually with them to assess their plans. We have put out guidance, which is already out there, about continuous learning that gives them sort of a roadmap of questions to ask yourselves to solve any of these issues, and we'll be doing more of that when we release that tomorrow as well.
Do you have a new survey on how many districts are taking part in distance learning?
Not yet. We don't have that survey yet, but we are working individually to gather information. Okay.
Thank you, Beth.
Governor.
Appreciate you. Okay, so we've got two questions for the public today that both deal with things that I think are better left for Alex. So he's going to come up and answer those questions, and then I'll come up to take your questions.
Thank you, Governor. So the first question is from Phyllis Marrero, and she asks, how long are asymptomatic people contagious? So this is a tough one to answer because we're still learning about the virus. It's worth highlighting, though surprising for us to say it, we're about 4 months into knowing about COVID-19 or the virus that causes that. The other challenge that we have is we know that 1 in 4 people around that could be asymptomatic and yet have the virus, meaning they could be out and about inadvertently spreading the virus. And we don't know how to monitor them shedding the virus because we don't know who they are because they don't have symptoms. But what we can say is the measures that we've taken to encourage people to stay at home, to wear face coverings as the CDC and now the state of Louisiana has recommended so that your nose and mouth are covered when you're out and about, would reduce the likelihood that any one of us who could be asymptomatically infected are shedding the virus or spreading it to other people. So encouraging folks to wear those face coverings, again, to limit being in crowds and being around other folks as much as possible. Next question comes from Shannon in Shreveport, and she asks, can mosquitoes transmit the virus? And I think here we're talking about coronavirus. From person to person. So again, we don't yet know definitively what the risks would be, but what I can say is it is extremely unlikely and extremely rare for an infection to be transmitted by mosquitoes, period. We don't see that with the common cold and coronaviruses other than this one, so I think very unlikely, but worth noting as we enter mosquito season, we still need to be doing what we can to avoid mosquitoes in our neighborhoods. Thank you.
Okay, so yesterday I was asked a question about OJJ, and I didn't have the information. I wanted to start there, and then I'll take your questions. The Office of Juvenile Justice has 31 youth in their custody, 27 in secure care facilities, 4 in contracted group homes that have tested positive for COVID-19. 1/3 of these youth are now considered recovered. 9 of those are in secure care facilities. And 1 is in a group home. Importantly, none of these kids are in a hospital. None of them required very much medical care at all. And this is, I think, owing to the fact that the virus has the least impact on younger people who are healthy, at least, and don't have the comorbidities that we've been talking about. Obviously, the Office of Juvenile Justice is closely monitoring the staff that they have in their various facilities. At this time, there's not a need to reduce the secure care population due to staffing concerns. I will tell you that per the request of 2 contracted group home providers, the OJJ has reduced their populations through extended home passes to accommodate for some staffing challenges that they have had. A total of 16 extended home passes have been granted, and as a precautionary measure, the Office of Juvenile Justice has begun coordinating with local courts on the possibility of extended furloughs for about 7 youth in secure care that do have some chronic medical conditions. And you all have been asking about recoveries. So I saw some modeling on recoveries, right? This is not some tally that we have tremendous confidence in as being exactly precise at this point in time, but based on the number of people who we believe have been tested positive, and that because of the elapse of time and how long it's been since they've been without symptoms, we have an estimated recovered population of 7,044. Is that right? 7,044. So that's a little more information for you today. So at this point, I'll take your questions. Yes, sir.
Have you given any thought to requiring people to wear masks in public, like I think they've done in New York, or maybe to wear a mask if you go into a grocery store?
You know, I haven't thought about requiring people to wear masks in public. As we transition into May, and obviously we're going to have to put out additional proclamations regarding the mitigation measures that are going to remain in effect, those that will be loosened, and then how we're going to try to reopen the economy while balancing the need to protect public safety and health. Then obviously we're going to be looking at some new measures. And whether I would mandate individuals to wear a mask, you know, I'm not certain. We're going to be looking at what the CDC's recommendations are on this, which I think it was a week or 10 days ago that they actually and by the way, time gets away from me, so it could have been 3 weeks ago, or it could have been yesterday. I don't remember. But that they actually started recommending for the first time that people wear masks when they're going to be out in public and unable to properly social distance. So if you're going to go to the store and you're going to be interacting with the cashier, that sort of thing, that you actually wear a mask, more so to protect others from yourself. But if everybody's doing that, then we're all protecting one another. So what I can tell you is more likely, and I probably shouldn't even be mentioning this because they haven't made the recommendations yet, but it would be more likely that we would mandate the workers at the stores and the restaurants, for example, that are going to be open, that they have to have a mask on. But it may extend to individual patrons. We just haven't gotten to that point yet. But we do know that there are going to have to be some additional mitigation measures in order to try to prevent the cases from spiking again. We've done a Herculean job of really turning around what was the fastest growth rate in the world in order to flatten the curve, and we know it wouldn't take long in order to see cases start to spike again, and we don't want that to happen, because if that happens, ultimately you're not going to be able to restart your economy the way that you want to, regardless of what you're trying to do. So you have to keep all of this stuff in balance, and we're going to be looking at what other states do. We're going to be consulting with the CDC. We're going to be looking at other public health experts, and of course I'm going to be leaning on Alex and Dr. Guidry and others here in the state of Louisiana to do this.
One other thing, when you're out and around, have you been pleasantly surprised or disappointed when you see the number of people wearing or not wearing masks?
I have been pleasantly surprised, but I'm not sure that when I'm somewhere, first of all, I don't go that many places, but when I was in Monroe, nobody came close to where I was that didn't have a mask on. I'm not sure that that's the way it is everywhere, but that's what I saw from the time I got to the airport until the time that I left, and so I've been pleasantly surprised. I am being told that more and more individuals are choosing to wear a mask in public, and by the way, I think it's something that we should sort of just wrap our minds around, that this is going to be the new normal for some period of time, and the normal we're not going to get to until there's a vaccine. And so we don't know when that's going to be, but it's likely a year or so from now, maybe a little longer before it's actually mass produced. I'm hopeful that because we have the best scientists in the world working on this all at one time, that the vaccine comes faster than we've been told to expect. But we have to plan for the worst case that is feasible, and we've been told that it's a year to 18 months before that's going to happen. Jeff?
LaToya Cantrell has extended the stay-at-home order for New Orleans to May 16th. Did the New Orleans consult with the state at all, and how will that maybe factor into your decision on what may happen statewide?
Well, everything factors into the decision, because we have to look not just at sectors of the economy, but at geographic regions as well, and try to figure out whether we take different actions in different locations. And obviously we will take into consideration her decision. I will tell you that I did not speak with the mayor. She did not speak with me. It's possible that she called some members of the Department of Health. I'm not aware of that. What we know is that when you hear talk nationally about hotspots for COVID-19, for cases, for death, for transmission, and so forth, New Orleans is always in that conversation. And by the way, it's not just Orleans Parish, because if you look at the map, we'll go back to the map, you see right next door in Jefferson, the case number is about the same, just a little below that. So it's that greater New Orleans metropolitan region. You got 5,769 cases in Orleans and 5,265, I think that is, in Jefferson. And so you would expect that hotspots would do things differently. So I'm not expecting the mayor of Ville Platte to necessarily do the same thing. For example, and by the way, I haven't talked to Jennifer lately. I don't know what she's thinking about doing. But so I'm not terribly surprised. And by the way, we've been told by the president when he releases his guidance, and I hope to get a better glimpse on this tomorrow during our video conference, that every region of the country is not going to be treated the same, and because there are some places where you don't have the problem that you have in other places, and certainly in Louisiana, there's not a community with more cases and more deaths than New Orleans. Yes, sir.
Going back to education to get your take on something, I know in your prepared remarks you said obviously state working to make sure, regardless of where in the state they're located, kids have access to resources. Obviously distance learning has been going on for about a month, and each day we get closer to the end of the school year. Is it likely that once the end of the school year comes, there's going to be a disparity of what students have learned or taken in?
Look, I don't think there's any doubt about that. And you just have to know about the disparities we have with respect to broadband access around the state. You know that in lower income populations, you're going to have fewer devices in the home, whether they are smartphones or computers and that sort of thing. And so you know that there are certain parts of the state that are not able to do this as efficiently and effectively as other parts. But I'm worried about all of it, because I happen to think that while Zoom is the best alternative, and distance education through a computer, online education is the best alternative, I happen to think students learn best when they're sitting in the classroom with that teacher there who can look at them and determine whether they're really paying attention and whether they're engaged, and ask them questions. And you can do that to some extent online, but you can't do it to the degree that you can do it in the classroom. So I'm worried about what's happening across the board and just trying to make the very best of what is not an ideal situation. And that is harder to do in certain communities than others. And this is not something we're learning for the first time today. Our Rural Revitalization Task Force already had identified critical infrastructure as one of their goals to work on, one of those things being high-speed internet access. We have the Broadband for Everyone in Louisiana task force is working on the same thing. And of course, we didn't realize that the pandemic was going to happen, and this public health emergency that was going to exacerbate the problems that we had seen and have an impact like it is having today on our ability to deliver education. But there are other things that schools and teachers and parents can do with respect to students learning, and it's low-tech distance education. And so, but it may be harder to do it, but you can still get that piece of paper in that student's hands, and you can still communicate through parents and find different ways to engage the kids and keep that instruction going. But I'm not going to sit here and pretend that that's as good as it would be if we hadn't canceled school. That's why I didn't take that decision lightly. But we know it's critically important to do. Just like the kids in Office of Juvenile Justice we were talking about, none of whom have needed any hospitalization whatsoever. That's the situation with the overwhelming majority of young people who will get this virus. But they're going to take it home to their parents. They're going to take it to their grandparents. They're going to bring it back into their communities. And so if you're going to really stop the spread, you know that a part of this has to do with schools. And that's why the CDC guidance is really clear on this. And by the way, it's not too early to start looking at what school looks like next school year, because we're not going to have the vaccine in place. And so you're liable to see schools taken in without large assemblies. You may see students arriving on campus at different times and leaving at different times, so they're not all congregated together waiting on buses and so forth. You may see some platooning of students, and these are all things that our school districts are going to have to work through under the guidance of the Department of Education and the Bessie Board, none of which is easy, and none of it is ideal, but it is necessary. Yes, ma'am.
Governor, I have two topics again. One is a quick one, which is, do you have any reaction to the Senate and Governmental Affairs Committee refusal to adopt the emergency elections plan today?
Yeah, so it's my understanding, and some of this was playing out late this afternoon when I was on some phone calls and so forth, so I'm not exactly sure what they did. It's my understanding they accepted the fact that there's a public health emergency. They just didn't like the plan.
H&GA accepted the public health emergency. S&GA deferred that and didn't even take up the plan.
Yeah. Well, look, Obviously, the Secretary of State and I have had an opportunity to visit. He presented his plan to me. I thought that it was well thought out and appropriate. Obviously, just like we're talking about changes to the way we do school and the way we open businesses and conduct ourselves in public, that changes to the way we conduct elections are warranted as well, because nobody should have to decide between exercising their right to vote and endangering their health or the health of others, depending on what the particular situation is. And that is especially true for the most vulnerable members of our society. So at one and the same time, and we don't know exactly what the situation is going to be in July and August, but I think the two dates now are July 11th for the primary, August 15th for the general election. But what we do know is that if we're going to have different procedures in place for the elections, you have to have lead time in order to prepare for that. And that's why the Secretary of State wanted to get a specific plan approved so that it could be implemented, and we'd have the time necessary to do all of that work. But nobody should have to choose between exercising their right to vote and potentially endangering themselves or others. And if you saw what happened in Wisconsin recently, I think that speaks loudly to the need for us to be thoughtful about how we move forward and conduct our elections. So I would hope that the legislature would take this into serious consideration and give the Secretary of State the ability to modify the election in order to make sure that people can participate to the maximum degree possible without having to make that decision about going into public if they believe they may have COVID or if they're potentially at risk because of one of the medical conditions or because of their age and that sort of thing.
Can I ask
Yes,
another question?
second question.
You've seen in some other regions of the country, I'm thinking the Pacific Northwest and then the New England states area, that states are working together on plans to sort of reopen their economies and how to move forward. Have there been any conversations with other governors in the South or any of our neighboring states about how you are approaching things here and how you will approach things going forward?
No, we haven't had those conversations. I can tell you there have been conversations between myself and Governor Reeves in Mississippi about particularly the Mississippi Gulf Coast and how many people live there and work in the greater New Orleans area and vice versa, and just how much transportation linkage there is between the two areas. But we haven't had specific conversations about trying to synchronize our plans to reopen the economy. And that may happen, whether it's with him or with Governor Hutchinson in Arkansas or Governor Abbott in Texas. But that hasn't happened to date. And I don't really see us doing what you were talking about, California, Oregon, and Washington on the one hand, and then it's New Jersey, New York, Connecticut, Massachusetts, and Pennsylvania maybe on the other. I don't see that's going to happen here.
Wow.
Yes, sir. Well, I just don't believe that it's necessary. I think if you look at the areas where this is happening, you have very similar situations in terms of the amount of COVID that they have in those various states, and they have a much greater degree of interconnectedness in terms of their economies and so forth. But if it's something that we believe we should consider, I certainly will. I haven't been pointed in that direction by anybody in state or anybody in these other states at this point. Yes, sir.
Governor, can you see Saints fans this fall in the Superdome for games, or LSU football fans in Tiger Stadium this fall?
Well, because I'm both a Saints fan and an LSU fan, I hope so. I know that I will see them there at least aspirationally until such time as perhaps it becomes obvious that can't happen. But it's April the 15th, and I'm just not prepared at all to go down that road to talk about what the situation will be this fall when it comes to that. I am prepared to say that if those things happen and fans are able to participate it's still not going to look exactly the same. There's going to have to be some precautions taken, and what those might look like, I don't know. I don't know if, and I'm thinking out loud here, I don't know if they can sell every other seat, every third seat. I don't know if they're going to have to try to figure out different ways to get people in and out of the game so that they're not all piled upon one another at one time. I don't know whether you're going to be temperature checked and make sure that you've got a mask to get in. I just don't know. But I can certainly see myself in Tiger Stadium, because that's where I want to be, yelling for the Tigers so that they can successfully defend their national championship.
Last question.
I guess that was the last question. All right, so tomorrow we're going to do things a little differently again, and I apologize. It's because we have a telephone conference tomorrow with the president and the coronavirus task force, and also because for some reason I've agreed to sit down with the advocate and do something that starts at 4 o'clock. And so our press conference tomorrow is going to be
11.
at 11. So I'll be here at 11 o'clock tomorrow to take your questions. As always, I want to thank you all for joining us today so that we can better communicate with everyone who's out there. And just remind everybody that, yeah, the numbers in terms of our cases and number of hospitalizations, number of events that are being utilized, they're all trending in the right direction. We certainly have flattened the curve, but it doesn't take much for these cases to spike. And we know how deadly it is. We know how contagious this disease is. And so I'm asking everyone to be patient, to comply with the stay-at-home order, to make sure that you minimize social contact, especially if you are sick. Do not get out of the house. Don't go to work. If you are vulnerable, you shouldn't be in any groups, period. And even though you can go in public and do certain things, such as go to the grocery store, you don't have to go every day. And not everybody in the household needs to go. And then continue to wash your hands frequently and vigorously with soap and water. Use hand sanitizer when you can't do that. Control your cough and maintain your social distancing. And when we do this, we're going to be in better shape. We're going to get through this sooner than we otherwise would. And yes, we are going to make sure that as we move forward, we strike the right balance as best we possibly can between protecting the public health and making sure that people can go back to work and that we can stand our economies up again. And we're going to do that in consultation with the doctors and the scientists, with the economists, and we're going to be relying upon the CDC, and certainly we want to be working with our federal partners as well. But this is, and you hear this all the time, it's unprecedented. The truth is it happened back in 1918, but there are not many of those people left to tell us what that experience was, and the situation has changed so much between then and now that I can say it is unprecedented. And so we're going to try to make the very best decisions that we can make as we move forward. And I continue to appreciate all the people of Louisiana who have been patient and who have been doing what we've been asking. And for those who, for some reason, have decided not to take this seriously, and they haven't been complying with the stay-at-home order and social distancing and hygiene, I once again implore you to do that. It is critically important. Be a good neighbor. And this isn't all about yourself. This is about your neighbor and making sure that we get through this together. So God bless you, and I'll see you all tomorrow.